All right, so you guys sent in this research article about canine cognitive dysfunction syndrome.
Yeah.
CCDS, which, it's basically like Alzheimer's, but in dogs.
Exactly.
And this one is a little bit heavy on the science. There's blood work, there's mouse models, and even some machine learning, but don't worry. We're going to break it all down for you guys.
We're going to extract all those golden nuggets of knowledge.
Absolutely.
And make it palatable.
Now, the potential here is huge, right? Early detection of CCDS. I mean,
huge, yeah.
That could change everything.
Imagine being able to, catch it.
Yeah.
With a simple blood test. That'd be amazing.
So let's talk about CCDS. Like, what is it?
So it's basically, when senior dogs start having problems with their thinking, they get disoriented, their social interactions change,
right.
Sleep gets disrupted, even house training can be a problem.
So it's like their world just becomes confusing.
Exactly. It's like they're slowly losing their grip.
And it's heartbreaking. As an owner, you just want to help.
Absolutely. And the problem is the symptoms, they can be very subtle, especially at first.
Yeah, you could mistake it for just...
Exactly. You might think, oh, my dog's just getting older.
Right.
But it could be something more.
And by the time it's really obvious, it's like...
It's often too late, yeah.
Too late.
The disease has progressed.
So that's where this research comes in, right? They're trying to find a way to detect it early.
They're looking for markers in the blood, biomarkers they call them.
Okay, so like a warning sign in the blood.
A red flag, if you will.
So they're analyzing blood samples from, I guess, dogs at different stages.
Exactly. Dogs with varying degrees of cognitive decline.
And they're also looking at...
And interestingly, they also studied mouse models.
Mice?
Yeah, mice with Alzheimer's and Parkinson's.
Oh, wow.
Looking for similar patterns,
So they're trying to find common threads between dog and human brains.
You got it.
That's fascinating.
And they weren't just looking at one biomarker, they looked at a whole panel of them.
Boy, so they're...
Yeah, they were looking for a unique fingerprint.
Looking for a pattern.
A pattern, exactly.
And did they find anything?
They did. They actually found 3 biomarkers that were consistently lower in the dogs with cognitive decline.
Lower. Interesting. All right, well, let's talk about these biomarkers. Like, what do they tell us?
So the first one is called RBP4, and it's a protein that transports vitamin A. Now, we don't fully understand why it's lower in dogs with CCDS.
Right.
But it suggests maybe there's a disruption in vitamin A transport.
Interesting.
Or metabolism.
Okay, so it might not be a direct cause, but it's definitely
a clue.
A clue.
Definitely.
And what about the other biomarkers?
The second one is CXCL10.
Okay.
And it's involved in inflammation.
Inflammation.
Okay. So decreased levels of this one suggest that chronic inflammation might be contributing to brain cell damage.
Which makes sense because we know inflammation is linked to all sorts of health problems.
It's like your body's alarm system stuck on and that can be a problem.
Got it.
And finally, there's NOx4, an enzyme that's been linked to human neurodegenerative diseases like Alzheimer's.
So, again,
lower levels in the CCDS dogs.
Lower levels, huh?
Yeah.
Okay, so we've got these 3 biomarkers all kind of pointing in the same direction.
Yes.
What did the researchers do with this information?
Well, here's where it gets really interesting. They didn't stop at just identifying the biomarkers.
Right.
They used machine learning.
Machine learning?
Yeah, those fancy computer algorithms.
Oh, okay.
To analyze the data and see which combination of biomarkers was the best predictor of CCDS.
So they're using technology to...
Exactly. They're training a computer to recognize the pattern.
That's pretty amazing. And what did they discover?
Well, the machine learning analysis found that the combination of RBP4 and NOx4 was super accurate in identifying dogs with mild cognitive impairment, or MCI.
MCI.
Yeah, think of it as the very early stage of cognitive decline.
So before the symptoms are even really noticeable.
Exactly, before you even notice any behavioral changes.
So a blood test could potentially tell us if a dog is...
on the path to developing CCDS.
Wow.
It's pretty incredible.
That is incredible.
It is. It really opens up a whole new world of possibilities for senior dog care.
It does, because early detection means...
early intervention.
Which means...
a better chance of slowing down the progression.
And a better quality of life for the dog.
Absolutely.
Wow, this is...
it's exciting stuff.
This is really amazing stuff.
It is.
It's really exciting, and I think it gives a lot of hope to... dog owners who are worried about their...
Absolutely. There's hope on the horizon.
Their senior dogs.
Absolutely.
So we've talked about what CCDS is. We've talked about these biomarkers.
Right.
And this incredible machine learning analysis.
Yeah.
But I'm curious, why do you think these two specific biomarkers, RBP4 and NOx4, turn out to be so predictive?
That's a great question. And it really gets to the heart of how complex the brain is.
Yeah.
Remember, these biomarkers aren't just random things floating around in the blood.
Right.
They're part of these complex processes that are essential for brain health.
Right.
Like RBP4, we talked about how it transports vitamin A, which is important for, vision, cell growth, immune function.
And NOx4.
NOx4 is involved in producing reactive oxygen species, which in the right amounts are actually good for the brain.
Oh, interesting.
Yeah, they're involved in cell signaling and immune responses.
So it's not just about whether these molecules are there or not, but
It's about the balance.
it's balance.
Exactly. It's like an orchestra.
Oh, I like that.
Each instrument plays a specific role, and the harmony of the music depends on, the timing, the volume of each note. Same thing with the brain. Even subtle changes in the levels of these molecules can disrupt that harmony.
Throw the whole thing off.
Exactly, and that can lead to dysfunction.
This is fascinating.
It is. It really is.
So if lower levels of RDP4 and NOx4 are linked to CCDS, could boosting their levels be a potential treatment?
That's a very good question, and it's definitely something researchers are looking into.
Okay.
But it's important to remember that correlation doesn't equal causation.
Right. Just because they're lower doesn't automatically mean that
Exactly.
raising them will solve the problem.
We need to understand why they're lower in the first place.
Okay. So we got to figure out the underlying.
The why, yes.
The why.
Exactly. It's like seeing a crack in a wall. You don't just want to patch it up without knowing what caused the crack in the first place.
Right. You got to
Is it a foundation issue? Water damage?
fix the root of the problem.
Exactly. You got to fix the root cause.
Okay. So more research is needed to really understand these biomarkers.
Absolutely. We're just at the beginning.
And speaking of research, you mentioned machine learning earlier. And I have to say, I'm really intrigued by...
It's fascinating stuff, isn't it?
It is. Can you tell us a bit more about how it works and why it was so important in this study?
Sure. So machine learning is a type of artificial intelligence where computers learn from data without being explicitly programmed.
Okay, so it's like...
It's like you give a computer a ton of information.
Right.
And you say, all right, find the patterns.
Find the connections.
Find the connections that we humans might miss.
Wow.
Yeah, it's pretty powerful.
So in this study, they fed the computer all the data on those biomarkers.
Exactly. RBP4, CXCL10, NOx4, the whole shebang from all those dogs with varying degrees of cognitive decline.
And the computer just...
And the computer crunched the numbers, figured out which combination was the most accurate predictor of CCDS.
Wow, that's...
It's like training a bloodhound to sniff out a specific scent.
Yeah.
You give it samples, teach it to recognize that scent. And in this case, the scent was that unique biomarker pattern.
And the machine learning, it was able to.
It nailed it. It pinpointed that RBP4 and NOx4 combo with amazing accuracy.
Especially in those early stages.
Especially in the MCI stage, yep.
That's incredible. So it's like...
It's like having a sneak peek into the future.
A glimpse into the dog's brain.
Exactly. And not just for detection, but for prediction, too.
Prediction.
Yeah, like we can potentially predict which dogs are at higher risk.
Wow.
This is pretty mind-blowing, right?
This is really, really amazing.
It is.
And it makes me think, if we could do this for dogs, could we...
Could we do it for humans?
Yeah.
That's the million-dollar question, isn't it?
It is.
And it's definitely something researchers are exploring.
Because, imagine if we could...
Imagine if we could catch Alzheimer's early.
Yeah.
Or Parkinson's.
Before the symptoms even started.
That would be game changer.
Wow, game changer, yeah.
Absolutely.
Wow, this is really...
It's exciting research.
It's really exciting research, and I think it gives a lot of hope to, not just dog owners, but to everyone who's worried about, cognitive decline.
It's a reminder that science is always moving forward.
That's true.
There's always hope.
So we've talked about a lot of the positives here, but I'm wondering, are there any potential downsides?
That's a good question.
Or challenges?
Yeah, like with any new technology, there are always things to consider.
Right.
I think one of the big ones is making sure this test is accessible.
Accessible to
everyone.
To everyone, yeah.
Not just, people with a lot of money.
Right.
Right. And then there's the issue of, what do you do with the information?
Yeah, that's a big one.
Like if you find out your dog is at risk, what are your options?
Are there treatments?
Right. Are there treatments? And even if there are, can you afford them?
Those are all really important things to consider.
Absolutely.
But I think overall,
it's a huge step forward.
It's a really positive development.
It is.
And it's exciting to see where this research goes.
Absolutely. Yeah. I can't wait to see what they discover next.
Absolutely.
It's fascinating.
This is really, really fascinating stuff.
It is. Yeah, it really does open up a whole new world, doesn't it? Like for senior dog care.
It does. And it's fascinating that it was these two specific biomarkers that were so predictive, like RBP4 and NOx4.
Yeah.
Any thoughts on why those two in particular?
Well, remember, these biomarkers, they're not just, random molecules floating around.
Right.
They're part of these intricate processes that are super important for brain health. Like RBP4, it transports vitamin A, and vitamin A is crucial for a bunch of things like vision, cell growth, even immune function.
Right.
And NOx4, that's involved in producing reactive oxygen species.
Now, those are usually seen as a bad thing, right?
Yeah, in excess, they can be harmful, but in the right amounts, they're actually important for cell signaling and immune responses in the brain.
So it's like a Goldilocks situation.
Exactly.
Not too much, not too little, just the right amount.
It's all about balance, right?
Right.
Think of it like, a seesaw.
Okay.
You need the right weight on each side to keep it level.
To keep it in equilibrium.
Exactly. And in the brain, that equilibrium is essential.
So if these biomarkers are lower in dogs with CCDS, does that mean we could potentially treat it by boosting their levels?
Well, that's what researchers are looking into, but it's important to remember that correlation doesn't always equal causation.
Right. Just because they're lower doesn't necessarily mean that's the cause.
Exactly. We need more research to figure out the underlying mechanisms.
The why.
The why, exactly.
So it's like, if your car is making a funny noise,
right,
you wouldn't just start pouring random fluids in there.
Exactly. You'd want to figure out what's actually causing the noise first.
Right. You need to diagnose the problem before you can fix it.
Precisely. And that's where more research comes in.
Speaking of research, I was really impressed with the use of machine learning in this study.
Yeah, that was pretty cool, huh?
It was. Can you explain a bit more about how that worked and why it was so important?
Sure. So machine learning is basically a way for computers to learn from data without being explicitly programmed.
So it's like giving a computer a giant puzzle.
Yeah, kind of.
And it has to figure out how all the pieces fit together?
Exactly. It's like saying, hey, computer, here's a bunch of information about these dogs and their biomarkers. Now you go find the patterns.
When it did.
It did. It found that the combination of RBP4 and NOx4 was the most accurate predictor of CCDS.
Especially in those early stages.
Especially in the MCI stage, which is amazing because that's when intervention can be the most effective.
Right, because if you can catch it early,
exactly,
you have a better chance of slowing down the progression.
Absolutely, and potentially even improving the dog's quality of life.
So it's like having a crystal ball, but instead of predicting the future, it's predicting
the likelihood of developing CCDS.
Exactly.
It's not a guarantee, but it's valuable information to have.
And it makes me wonder, could this type of technology be used for other diseases?
Oh, absolutely. I mean, machine learning is already being used in all sorts of medical research.
Right.
From cancer detection to drug development.
So this is really just the tip of the iceberg.
It is. We're just scratching the surface of what machine learning can do.
This is really incredible stuff. And I think it gives a lot of hope for the future of veterinary medicine.
It does. It really does.
So we've talked a lot about the science here, but I want to bring it back to the practical side of things for a moment.
Sure.
If this blood test becomes available, what should dog owners be thinking about?
Well, first and foremost, I think it's important to remember that this test is just one piece of the puzzle.
Right. It's not a diagnosis in and of itself.
Exactly. It's a tool that can help veterinarians make more informed decisions.
So it's important to talk to your vet.
Absolutely. They'll be able to interpret the results in the context of your dog's individual health history.
And they can help you come up with a plan.
Exactly. Whether that's monitoring the dog closely, making lifestyle changes, or considering medication.
It's all about being proactive.
It is. And early detection is key.
Because the earlier you catch it,
the more options you have.
And the better the outcome for the dog.
Absolutely.
Now, I know there's no cure for CCDS yet, but are there things that can be done to manage the symptoms?
Oh, definitely. There are a lot of things that can help. Well, there are medications that can address specific symptoms like anxiety or sleep disturbances.
Okay.
And there are supplements like omega-3 fatty acids that can support brain health.
Right.
And then there are things like behavioral therapy.
Oh, interesting.
Yeah, you can teach dogs new tricks, even old dogs, to help them cope with cognitive challenges.
Well, it's like keeping their minds active.
Exactly. Use it or lose it, right?
And even simple things like creating a predictable routine.
Yes, that can make a huge difference.
And minimizing clutter.
Absolutely. Anything to reduce stress and confusion for the dog.
So even though it's a challenging condition, there's still a lot we can do.
There is. There's a lot of hope.
To help our furry friends.
Absolutely.
Well, this has been an incredibly informative deep dive.
It has been, hasn't it?
It has. I've learned so much about CCDS, and I'm really excited about the potential of this new blood test.
Me too. It's a game changer.
And I think it's a great example of how science is constantly pushing the boundaries of what's possible.
Absolutely. And it's all for the benefit of our furry companions.
Which is what it's all about.
It is. At the end of the day, we just want to keep our dogs happy and healthy.
And this research is a huge step in that direction.
It is, and I can't wait to see what the future holds.
Me either. I'm sure there are even more amazing discoveries just around the corner.
I think you're right.
All right, well, we've covered a lot of ground today.
We have.
From the science of biomarkers and machine learning to the practical implications for dog owners.
It's been a whirlwind.
It has. But I think we've given everyone a good overview of this exciting new research.
I hope so.
Now, one thing that really stood out to me was the fact that the levels of those biomarkers were actually lower.
Right.
In dogs with CCDS.
Lower, yeah, it's counterintuitive.
I would have thought they'd be higher, like
yeah, you'd think so.
like more of something bad.
More inflammation, more damage.
But it's the opposite.
It is, and it really highlights the complexity of these biological processes.
Yeah, it's not just about the presence or absence of something, but
it's about the balance.
The balance.
The delicate interplay of all these different molecules.
And when that balance is disrupted,
that's when things start to go wrong.
That's when we see the cognitive decline.
Exactly.
So if these biomarkers are indeed lower in dogs with CCDS, does that mean that boosting their levels could be a potential treatment strategy?
Well, that's definitely a question researchers are exploring.
Because, it seems logical, right? If lower levels are bad, then higher levels might be good.
Yeah, on the surface, it seems that way.
But of course, it's never that simple.
No, it's not. We need to be careful about jumping to conclusions.
Right. We need to understand the underlying mechanisms first.
Exactly. We need to figure out why those levels are lower in the first place.
Because it could be that those lower levels are a symptom of the disease, not the cause.
Precisely.
So simply raising those levels might not actually address the root of the problem.
It's like putting a Band-Aid on a broken bone.
Right. It might make things look better on the surface, but
it's not actually fixing the problem.
We need to find a way to heal the bone itself.
Exactly. And that's what researchers are working on.
And that's why this research is so important.
It is. It's laying the groundwork for future discoveries.
It's like those early explorers who set out to map uncharted territories.
I like that analogy.
They might not have found all the answers,
but they paved the way for others to follow.
Exactly. And that's what's happening here.
And who knows what amazing things we'll discover along the way.
Well, this deep dive has certainly been an adventure.
It has.
We've delved into the intricate workings of the canine brain.
We've explored the cutting edge of science.
And we've even touched upon the ethical considerations of this research.
It's been a fascinating journey.
And I think it's a reminder that science is a constantly evolving process.
It is. There's always something new to learn.
And that even the smallest discoveries can have a huge impact.
Absolutely.
Speaking of discoveries, I was particularly intrigued by the researchers' use of proteomic profiling.
Ah, yes. That's a powerful tool.
Can you tell us a bit more about that?
Sure. So proteomic profiling is basically a way to analyze all the proteins in a biological sample.
Okay, so it's like taking a snapshot of all the proteins in the blood.
Exactly. It's like a molecular inventory.
And by comparing those inventories from healthy dogs to dogs with CCDS,
they were able to spot the differences.
Differences, right?
Like those lower levels of RBP4 and NOx4.
So it's like a giant game of spot the difference.
It is, but instead of looking for differences in pictures, they're looking for differences in proteins.
And those differences can provide valuable clues.
They can. They can tell us a lot about what's going on inside the body.
So proteomic profiling was really the first step in this research.
It was. It helped to narrow down the field of potential biomarkers.
And then they used more targeted techniques to confirm their findings.
Exactly. It's a multi-step process.
And it really highlights the power of combining different approaches.
Absolutely. The more tools we have in our toolbox, the better.
And that's what's so exciting about this field of research.
There's so much potential for new discoveries.
And those discoveries could lead to new treatments, not just for dogs, but for humans as well.
That's the ultimate goal, isn't it?
It is, and I think this research is a big step in the right direction.
I agree. It's giving us a glimpse into the future of brain health.
And it's a reminder that we're all connected.
We are. Human health, animal health, it's all intertwined.
And by working together, we can make a difference.
Absolutely. And that's what makes this research so inspiring.
So we've talked a lot about the science, the biomarkers, the machine learning, but let's bring it back down to earth for a minute.
Okay.
What does all this mean for the average dog owner? Like, if this blood test actually becomes available at the vet, what should people be thinking about?
That's a great question. And I think the first thing to remember is that this test, it's just one piece of the puzzle.
Right.
It's not a crystal ball. It doesn't definitively tell you what's going to happen with your dog.
So even if the results show some red flags, it's not
a reason to panic.
Not a reason to panic, yeah.
Exactly. It's a starting point for a conversation with your vet.
So talk to your vet.
Absolutely. They'll be able to look at the results, consider your dog's individual health history, their breed, their age, all those factors.
And come up with a plan.
Exactly. It might be just monitoring the dog closely. It might be making some lifestyle changes, maybe even considering medication.
But the key is
early detection.
Early detection, because the earlier we catch it, the more options we have.
And I know there's no cure for CCDS yet, but are there things that can be done to, manage the symptoms to help the dog?
Oh, absolutely. There's a lot we can do.
Like what?
Well, there are medications that can help with specific symptoms, like anxiety or sleep problems.
Okay.
There are supplements, like omega-3 fatty acids, that can support brain health.
Right.
And then there's behavioral therapy.
Behavioral therapy for dogs.
Yeah, you can teach them new tricks, keep their minds active. Even old dogs can learn new things.
So it's like use it or lose it.
Exactly.
For the brain.
For the brain, absolutely.
And I guess even simple things like, creating a predictable routine.
Oh, that's huge. Routine is so important for dogs with cognitive decline.
And minimizing clutter, making the environment less confusing. Absolutely. Anything to reduce stress and make them feel more comfortable.
So even though it's a tough diagnosis, there's still a lot we can do to help.
There is. And I think that's the most important message here. There's hope.
Hope, yeah.
And there's a lot we can do to support our furry friends.
Well, this has been an incredible deep dive.
It has, hasn't it?
I feel like I've learned so much.
Me too. It's fascinating stuff.
And I'm really excited about the potential of this new blood test.
Oh, me too. I think it's going to be a real game changer for senior dog care.
And it just goes to show you how powerful science can be.
Absolutely. And it's a reminder that we're always learning new things, always pushing the boundaries of what's possible.
And that's what makes it so exciting.
It is. It really is.
Well, I think we've covered just about everything on this topic.
I think so. We've gone from the nitty-gritty science to the practical advice for dog owners.
And I hope everyone listening feels a little bit more informed and empowered.
I hope so too. Knowledge is power, after all.
Absolutely. And I want to thank you for joining us today and sharing your expertise.
It's been my pleasure.
And to everyone listening, thank you for being a part of this deep dive.
And remember, from Vet Neurojar, keep those minds inspired, hearts light, and tails wagging.